Hello everyone, I'm Susan Cole.
And I'm Vanessa Apea.
And welcome to Health and Power, the live broadcast series on health inequalities affecting people of colour and, crucially, steps we can take to fix it.
Thanks so much, Susan. Great to be here again, and Happy New Year to you and to everyone. So today, as ever, I always say this, but we are always so fortunate to have really wonderful guests, and we've got two great people with us today. So without waiting, because we've got lots to cover and talk about today, we have Rianna Raymond-Williams, and we also have Professor Sam Seidu. So Rianna Raymond-Williams is a PhD student at Glasgow Caledonian University in London, and her research aims to really explore how Black Caribbean women in the UK experience sexual and reproductive health care. And as part of documenting her PhD journey, which has been fantastic, is Rianna hosts a podcast called Re Speaks, which really aims to shine a light on all the amazing and inspirational activists, researchers and practitioners and more that exist really inside and outside of academia. And in 2022, Rianna was awarded the prestigious Magnuson Fund Award, which is to pursue an exchange project in Jamaica in partnership with the University of West Indies. And I've been really fortunate to know Rianna over a number of years, and Rianna has 10 years experience working in sexual and reproductive health, the founder of a social enterprise, Shine Aloud UK, and also in 2020, she's directed a short animation, and I'm so looking forward to hearing more about this work, and also an anthology that she led on. So it's great to have Rianna on and hear about how she's really merged youth work, community organising, and her journalism as well. And then we have, as I said, Professor Sam Seidu, who is a professor in primary care diabetes and cardiometabolic medicine. And he's currently the vice chair for research for Primary Care Diabetes Europe. He's a board member of the Primary Care Diabetes Society of the UK, and is also currently a clinical lead and mentor for diabetes in Leicester, Leicestershire, and Rutland Integrated Care System. In 2021, he was named the most outstanding early career researcher by the Royal College of General Practitioners, and he's also an associate editor of the Primary Care Diabetes Journal. So, Susan, amazing guest, amazing stories.
Absolutely amazing guests. I'm really looking forward to finding out more about their work. So truly inspirational. And one of the things that we were talking about earlier was just some of the issues that have been on the news recently. And something that's really struck me is the difference that Black women in the workplace are treated. Latest data shows that Black women of Caribbean descent are paid a quarter less than white male counterparts. But it's not just about pay, it's also other issues that are happening in the workplace, more pressure being put on Black women, but less support. And also things like bullying. And I know that many of us are conscious of a Black professor taking her own life in America last week, and the impact of how Black women are treated in the workplace can really impact on our mental health. But I read last week where someone said, if work is costing you your peace, it's too expensive.
Thank you, Susan. And that is just such a powerful statement, but I think really just says it all. And you're so right. There's been a number of episodes that have been discussed in the media in this new year that have been really quite shocking. And we've heard about Dr. Claudine Gay in Harvard University, and some of her treatment as well. And it's one of the things that I think that is so important is shining a light on this, number one, because these are people that have had a certain prominence and it's now been shown in the media, but there are countless women that experience these difficult workplace experiences every day. And there are also very limited spaces in which women and Black women can come together and discuss and share, and also hear that they're not alone. And because often when you are being bullied or minimized, experiencing microaggressions, it can feel really personal, one-on-one, and it can feel that it's only me experiencing it, and how do I manage it? And so I think there's lots of reflection in social media at the moment, and we really acknowledge that, and also just think about how we can create spaces that we can talk more. And this is one of the reasons that why we did do Health and Power, just to shine a light and think about what next, really.
Absolutely. I very much agree. And it's so important for people to realize they're not alone. And I think it's brilliant that we've got Rianna on next, who can talk about some of the issues that Black women experience. Hi, Rianna.
Hi, good evening. Thank you so much for having me.
Rianna, it's wonderful to have you here. And it's, as we've just been mentioning about the experience of some Black women in academia, it really resonates. It resonates with me because as well, doing a PhD currently and having more work in that academia space. And it's very much like you. So can I just ask, what's been your PhD journey, particularly as a Black woman?
It's been an interesting one. Interesting because I guess on one hand, it's given me the space and time to focus on something that I'm really passionate about, which is Black women's health, and in particular Black Caribbean women's health, because my heritage is Jamaican, so Caribbean. And I think there's a particular difference between how Black Caribbean women and Black African women access care, receive care, and provide care, and something I want to explore a bit more. But I guess on the other side of it, I really recognize the inequalities within academia in terms of thinking about books that we don't access on our course because people don't see Black knowledge as valuable or creditable, and thinking about the other ways in which I've had to be a part of networks outside of my institution to find knowledge, to find thinkers, to find opportunities that really link to the work that I'm exploring. Because I guess the curriculum of universities are very much white-centric and Eurocentric, and don't give space and time to Black academics to kind of share their knowledge and perspectives, and even speak to racial justice or injustice, which is what I guess part of this podcast is about, highlighting these issues that exist.
Thanks,
Absolutely.
Rianna. It's when I listen to that in terms of when you talk about the lack of scholarship and Black scholarship that's acknowledged, and it's there. It's not that it's not there. It's just that it hasn't been brought to the forefront, and we're in a very Eurocentric spaces in academia, and that visibility just isn't there. And so it's just wonderful to see your work and to see that you're bringing that forward, because that's exactly what's needed.
Absolutely. And you have some quite creative approaches to tackling some of the inequalities that Black women are experiencing. Can you tell us a little bit about your work?
Yeah, so I think it's helpful for me to give an example of my previous kind of creative work, but also currently. So a few years ago, I worked on a short animation called I Know He Loves Me. And it was aiming to shine a light on intimate partner violence from the perspective of a young Black woman. And I think after speaking with Black women, they were very much aware of how physical violence presents, but not necessarily aware or not necessarily comfortable with acknowledging the ways in which manipulation or mind games or control presents in ways that are not physical. So the animation really shines a light on that, so we can begin to recognize the signs and also seek support to help us. And I guess in relation to my PhD, there's a methodology that I've been trialing, which is called unboxing. So there's lots of things online around unboxing where people get delivered random packages and kind of unbox it online, and people kind of just share whatever's in the box. And I guess in a similar way, I've used methodology in my research where I filled a box with different things relating to Black women and health. And I guess these items and phrases are numbered from 1 to 30. And gradually I pull things out of the box. So the things could be a speculum, it could be a condom, it could be breast, it could be a vulva. And I guess it's a way of sparking conversation with Black women and providing a space where we can have conversations about things related to the phrase or pictures in a way that's a bit more considered and sensitive and culturally responsive, like having images that reflect parts of our body or parts of things that we see in our communities, as a way of trying to like spark conversation and motivate responses in comparison just expecting people to show up in a space and speak to you about things that are so sensitive.
Gosh, I love that, unboxed. I need to do that with my family. But no, because I think that, as you say, we ask people to talk about their lived experience and talk about where they are at, but we don't often create enough a safe enough space to do that, or assuming that people have the words to express what they need to say. And something like Unbox, I can really see that can trigger conversation in such a powerful way. And Rianna, I said earlier that I've known you for a number of years, and one of the things that I remember really clearly is that I had seen some of your work on Shine Aloud, but I didn't know it was you. And then I remember meeting you and then thinking, oh my gosh, it's you. But also the fact that it was really beautiful that, you know, there was a Black woman behind it leading this work. So do you mind sharing a bit about Shine Aloud and really your perspective of mental health?
Absolutely. So I think at times there can be a bit of confusion because Shine came from the sexual health service that I used to work for, but also used to volunteer with when I was a younger person. And I guess the name came out of that inspiration and community of young people that I was really connected to, found friendship in, and were just really inspired to create more content around sexual health. And I guess it started as a magazine, which aimed to act as a resource for young people. And it was an opportunity for me at the time studying journalism to combine my interest in arts and culture with sexual health information to provide a resource, I guess, that was culturally sensitive and reflected, I didn't know at the time, but it's definitely reflective of Black people's lives and experiences, and making it a bit more accessible, because I think sometimes we have resources that aren't accessible, they're very medicalized, they're very formal, and I guess this was a fun, entertaining, engaging way to try and communicate sexual health information to people. So it started as a magazine, it's then developed into workshops nationally and internationally, and also producing content, as I mentioned, the short film. So yeah, I guess it's a chance for me to really think about how do we explore creative means to creating sexual health information for young people, particularly young Black people or racialized people, because I think there's still a group of people I've forgotten or not invested enough in, which I think something we need to address long term.
Absolutely. It's so powerful and important to actually have information that's accessible and actually entertaining and engaging, because so often it feels like information really isn't directed at us. So what you're doing is incredibly important. And I'd like to find out a little bit more about your animation about intimate partner violence, because we know that Black women are disproportionately affected by intimate partner violence. What do you think's driving that, and what can we do about it?
I think there's so many layers to that conversation. And I think it's in terms of how Black women feel received, understood, respected, valued or not valued. And sometimes they find themselves in circumstances that they know are unhealthy, but don't access or don't have awareness of the support they could access to kind of address the current circumstances. And I guess the work that I do now is informed by a real life example of that. At the age of 16, one of my really good friends was in a very volatile relationship. And the group that I accessed at the time was a little youth group called Shine Aloud. And I guess I, as the best friend of that person, went to the group to support her. But at the time, she didn't see or wasn't able to kind of understand the violence or the harm that she was being exposed to. So I guess in a way, I was brought to this work through supporting a friend, and thankfully she's no longer in that relationship as life has evolved for her. But I recognized there was something about me being able to see this thing, this group and this support as like helpful, supportive, educational. But for her, the pull to be in that relationship was much too strong. And I think it relates to not having culturally sensitive support, understanding. Probably when she went to seek help, they looked at her as a young racialized person and didn't see her vulnerability. And this is what the animation tries to shine a light on, that even if people, whatever way they present, they still are in need of support and care. And I think sometimes perceptions are made about Black and racialized women's bodies in terms of how they look, how they sound, what they wear, what they don't wear, is an indication of us not being vulnerable. And I think we need to continue to explore what that means and reflect on how it continues to create more harm for Black women in particular.
Oh, thank you, Rianna. I think you put that so eloquently, and it's a really powerful animation. So just for people to try and watch it, but the fact that what you've just said in terms of that lack of appreciation that often Black women's bodies and who they are not respected or protected or valued, and that can be culminate in so many different ways and many negative ways in their life. So thank you so much, Rianna. It's been fantastic to have you.
Thank you
so much, Rianna. Looking forward to seeing the animation.
Thank you. You take care.
Take care. Bye-bye. Wow, that's something that's come across throughout the series, is the way that Black women just aren't protected very often, how we're perceived. And sometimes, when we are feeling really vulnerable, we're accused of being angry, and it can be really hard to navigate so many systems when we're attacked from so many different levels.
Well, I think that's it, isn't it? It's about being attacked at multiple levels. And, we've talked about workplace, and then you're being attacked there, and then you're being attacked in your personal life as well. And, where is the respite in that? And it really is about thinking about how we've got to look forward and how we can support initiatives and policies to really address the needs of Black women.
Absolutely.
So today, Susan, is Martin Luther King Day.
Yay!
And exactly. And it's always a day that I think is really important, because it's always been focused in America, but has obviously so much relevance to our lived experience in the UK. And it is really just an opportunity to reflect on the work of Dr. Martin Luther King, but also, what he stood for in terms of tackling racial inequities and social action and change, and really embedding it in our society. And it's everyone's problem, and everyone needs to address it, and not individuals. So I think it's really important that we acknowledge it, particularly in Health and Power today. It's quite poignant for our last one of the series.
Absolutely. I very much agree. It's so important. But I think sometimes people take the progress that came from Dr. Martin Luther King a little bit for granted. But I think at the minute, the times that we're living in, so much of what he stood for is under attack. So many initiatives are now perceived as just being like woke and not being valued. So I think it's really important that we stay awake to the injustice that we feel, because the fight is not over. It's really easy for people to get behind concepts like Black Lives Matter if they think that, we're being murdered or we're being attacked. But it's a lot harder to meaningfully support social change that's going to be lasting and that impacts us across so many different spectrums. So, the fight continues.
It does indeed, and I nothing to add to that, because you put it so well. And I think that for me, with Martin Luther King, it's that hope and having that resilience to just keep going, and to say that we respond and heal. So we have another fantastic guest, Professor Sam Seidu. Welcome.
Thank you very much, Vanessa. Thank you, Suzanne. Thank you.
Sam, it's wonderful to have you here, and I'll openly say that I've been trying to get Sam on for a number of months, and he's been so kind to accept my nagging. So, public, thank you.
Thank you. Thank you. I'm delighted to be on this show. Thank you.
Oh, fantastic. So, Sam, first of all, I just wondered if you'd actually explain what diabetes is, because it's a common diagnosis and everyone uses the word, but I'm often unsure whether everyone understands truly what it is. And so it'd be great with your expertise just to give us a bit of a summary.
So in lay terms, it is a condition whereby the body's way of processing sugar in the blood is a bit disordered. And so you tend to have excess sugar accumulating in the bloodstream, not well controlled. Now, if that happens and it's not well controlled over time, what happens is that the excess sugar starts to damage the nerves and the blood vessels, which could lead to complications such as kidney failure, leg amputations, heart attacks, and strokes, and even blindness. The important thing to do is to diagnose it early, manage the condition to prevent these complications from occurring.
Thank you so much, Sam. And I sometimes I feel a little bit like a diabetes walking time bomb, because both my parents have had diabetes, quite a lot of my relatives, so many people that I know. And we know that people of colour are disproportionately affected by diabetes. What do you think is actually causing this?
The causes are there are a number of causes, and research has shown that obviously people of color are more likely to have diabetes, and weight issues, much higher abdominal circumference in some ethnic groups is also associated. Family history of diabetes, all of these are risk factors. And you mentioned Black people and indeed ethnic minorities. They get it about 2 to 3 times much more frequently than white colleagues, and they do get it a lot sooner. The risk of developing diabetes tends to rise after the age of 40 in white Caucasians, and this is about 25 in Black people. When they get the condition, especially type 2 form of diabetes, the complications that they get occur much sooner, and they are actually more aggressive in these populations compared to white Caucasians. Causes of that, like I said, we're not sure, but I suspect it is, intimately tied to the lifestyles. Our dietary habits are slightly different. Physical activity is an issue, and indeed access to health is an issue. There are a lot of interventions that are available for everybody in the country to prevent them getting diabetes. We have a national diabetes prevention program. And over the past 5 years, a lot of work has gone into this area to encourage people to participate in diabetes prevention activities. And this has helped. Recruitment into this program has been consistently high in all ethnic groups. But one would still see numbers of certain minority populations, such as Blacks, being much less compared to other ethnic groups. So yes, the causes of them are a lot. Our lifestyle, the food we eat, especially people from African and Caribbean areas have, carbohydrate-laden diets. And these diets, when they digest, become sugar in the blood. And so it's about knowing, not stopping to eat your favorite dishes, but just knowing the effects of these dishes on your body's handling of the sugars. And just tweaking things around here and there to make up for the reductions in carbohydrate that you're taking.
Thank you so much, Sam, because you clearly have talked about the inequalities that are seen in diabetes, and the inequalities also in accessing prevention. But what I found really interesting that I didn't actually realize, and Susan and I reflected on as well, is the inequalities we see in terms of treatment as well, in terms of access. And I just wondered if you could share that, because I don't think many people are aware of it.
Yeah. It's actually interesting you bring that up. So there have been several studies, research studies that have looked at this topic, and I've seen the data showing that over the past 2 decades, the prescribing of newer therapies for diabetes in Black people is lagging behind that of white colleagues. One study shows that they are 70% less likely to receive these agents compared to white colleagues. And indeed, last year, we got very interested in this topic and decided to do a study on this area to see the effects of these medications on the 3 major ethnic groups that we have in the UK: white, Caucasians, South Asians, and Blacks. When we looked at the data, we actually realized that these newer medications were not actually as effective in reducing the clinical outcomes in Black populations compared to the other populations, which was surprising. In fact, we got scared because what we set out to find was some finding that these agents were better in protecting the heart and the kidneys in Black populations. So we can make a case for more ubiquitous use of these agents. Unfortunately, we found the reverse. And the question that has been asked is, why is that the case? Is that the Black body is biologically different? But I don't think it is the case. The reason I'm bringing this up is because what was clear in the study is that the numbers of patients from the Black population that were recruited for all the trials in the studies was much smaller compared to the white populations, which could indicate that it is a question of representation in research trials. And so if you don't have enough numbers of Black people represented in the trials, you are unlikely to find the desired effects of the drugs. So that was one of the headline findings. Having said that, when we then compared the representations in trials in South Asians and Blacks, they were similar. And yet South Asians got much more significant benefits with respect to kidney and heart outcomes. So the question still remains, yes, representation is an issue, but we calling on researchers across the globe to look at this topic much more closely, so that in this day and age of precision medicine, we can actually get the right therapies for the right person to achieve the desired outcomes.
Right, thank you so much, Sam. And I think that that's a theme that has come up quite a lot on the broadcast, is in terms of representation in trials. But what other actions do you think is also needed to address the inequalities that we're seeing in diabetes?
Well, we have mentioned the issue of access, and that is something that is well known. But what is less spoken about is the issue of the representation and research that we've talked about. To improve outcomes, you've got to have the evidence. And the evidence does not exist so much for Black people when it comes to diabetes and cardiometabolic conditions. It is there, but it's much less so compared to whites and South Asians in this country. So what can we do about it? Well, there is always a case that the reasons why Black people don't participate in research in this area is because of historical mistrust issues. That's always been cited. How do you address that? Well, to address that, I think one of the key things that you can do is to get Black academics doing these research trials. But you don't pluck them off the tree. They don't exist. You've got to grow them. So Rianna's talk was very, very apt. She talked about, Black academics and research. So in the diabetes field, we have the same challenge. But thankfully, Diabetes UK is taking the lead on this. They have identified this as an issue. And Diabetes UK, which is UK's, biggest diabetes charity, is now funding, they've put in funds across to push Black academics into research. So there is now funding starting from this year, actually, for internship for Black people who want to go into academia in diabetes to apply for internship. And then from next year, there will be PhD opportunities just limited for the Black population, Black people, to do research in diabetes. So we believe that when you do this, you're going to have to, in the end, you create the Black academics who will spearhead this research in this area. And in time, you can improve the recruitment that will eventually answer these questions of inequality that we keep facing. For now, what can we do about it? Well, I always say that you have to recognize the problem and do something about it. We have to work with what we have, just encourage participation, make access to healthcare services equitable to everybody. And more so, the Black populations, it's not just making it, easy access or equal access for everybody. If you do so, the Black population, and indeed some deprived populations, will still not be able to access it. You have to commit to, increasing time and human resource and funding capacity targeted at these populations. That initial capital outlay usually is high, but the dividends that you reap from there usually will pay off.
Wonderful.
Well, Sam, I have to say that I can think of a more beautiful way to kind of end in terms of those reflections, in terms of being dedicated to equity and realizing that the dividends will pay off, even if it feels in the beginning so a lot of resources, but it pays off and it's the right thing to do. So thank you so much, Sam, for coming on. It's been wonderful.
Thank you.
Take care.
Oh my goodness, Vanessa, we're coming to the end and it's the last show in the series.
I'm shocked.
I actually feel really emotional.
Yeah, I have to say, Sam said it really beautifully at the end, kind of tying it all together. But thank you for being a wonderful co-host. I've loved doing this series with you.
And thank you, Vanessa. It's been an absolute joy. I've loved every moment. I like to thank all of the amazing guests that we've had over the last year who've shared their incredibly important insights. And also I love the fact that it's been really solution focused. It isn't just been about these are the problems. Everyone's talked about actions that need to happen to bring about real change. And I think it feels quite unique and quite special what we've done. And I'd also like to thank Disruptive Live for making all of this possible, particularly wonderful Cameron, who's been the pilot throughout the series. Cameron, we love you. We love your patience. I'd like to also thank the lottery for funding to make this possible. It's been an absolute joy. And I hope that we will be coming back.
Exactly. We can't start the year with our final show of the series and not come back. So no, we definitely must come back. But thank you to everyone. As Susan said, it's been a fantastic year. Thank you.
Okay, thank you. And Happy New Year, everyone. Let's keep up the fight.
Exactly.
Thanks. Bye.
Bye.